The last part of examination of the nervous system is examining Janelle's muscle stretch reflexes. One of the things you need to remember when testing for reflexes is that once again you're actually testing three components. You're testing first of all the muscle itself, you're testing the spinal cord reflex arc, but you're also testing higher motor centres. And you need to remember that it's possible to get a muscle stretch reflex, in fact even a pronounced muscle stretch reflex, even in a case where a patient has a spinal cord transection above the segment of spinal cord you're actually testing. It's important to remember that the muscle stretch reflex is normally modified by the higher centres, that is, by the motor cortex. And in the normal person with an intact motor system, the reflex will be diminished somewhat, particularly if the person's sort of focused on the reflex. It's actually a good idea to get the person to focus away from the reflex you're testing and to perform what we call reinforcement. For example, by gritting their teeth together or putting their hands together and pulling to produce muscle tension in some other part of their body so that the muscle stretch reflex is actually more pronounced. So in people that have diminished reflexes or zero reflexes, who are perhaps unconscious, we would probably suspect a problem either with the local reflex arc segment or the muscle. In cases where the reflex is actually pronounced, we might suspect a problem with the motor cortex and therefore, for example, a head injury, such as increased intracranial pressure, a hematoma pushing on that part of the motor cortex. And as a net result, the reflex arc is accelerated or more pronounced because of the effect of the spinal cord, which is unimpeded, or some other part of the motor system, such as the basal ganglia. So therefore, reflexes are normally categorised on a 4-point scale from absent to pronounced. How that scale works really is a matter of getting used to what we regard as a normal reflex. Once again, we're comparing one side with another. We'll start off with the biceps reflex. And the biceps reflex, we're going to ask Janelle just to relax her arm, just put it across, rest it on a lap. We're going to place our thumb just below the elbow, the cubital fossa, and I'm going to use the patella hammer to strike my thumb, which in turn will strike her biceps reflex and should produce flexion of the elbow, which of course we can see is happening. We'd regard that as a fairly normal reflex. Janelle, just grit your teeth for me. Just clench your jaw as hard as you can, and we'll just see if that makes any difference. And it doesn't really, although there is a slight increase in the reflex, which we'd expect. Just testing the other side, same process. Just placing the thumb over the tendon, and the reflex is much the same. The next reflex we test is the triceps reflex, and again with the elbow bent, just arm relaxed, and again now we're looking for an extension of the elbow. We can actually support the upper arm just to make it a little easier, and we strike again looking for extension. And again just comparing it with the other side, just relax that arm, Janelle, and again just supporting the upper arm. And with the triceps reflex we can also, just to make it a little easier, actually support the arm. If you just relax your arm, support it in an upwards direction, and the same process, it's just really up to you as to which you find the easiest. That's triceps and biceps. Brachioradialis reflex, or the wrist reflex, again just the arm relaxed, and we're looking for extension at the wrist, and it's just a slight tapping. We can see there quite a pronounced reflex. Same on the other side. And again, that's completely normal. we'd probably categorise that as a 2+ reflex. On a 4-point scale, that's about an average reflex we'd expect in someone that's quite conscious, talking, and has got an intact muscle, intact reflex arc, and subduing somewhat of the reflex from the higher centres, namely the motor cortex. The patellar tendon reflex, might add that we can also do an abdominal reflex. We won't in the case of Janelle. All it involves is stroking the abdomen, and we'd expect to see the abdominal musculature move towards the reflex hammer, just using the opposite end of the reflex hammer. Patellar tendon reflex, we just get you to put one leg across the other, doesn't matter which we start with. Again, just relax. And here is a case where we probably need to get Janelle to perform reinforcement or to focus on some other muscle group. So I wonder now if you can put your hands together and pull as hard as you possibly can. And we can see a diminished reflex, not abnormal. Most people expect some sort of reaction at the patellar tendon, and the higher centres counteract it to some extent. So the same thing, performing reinforcement. Again, we're expecting to see extension at the knee joint. And yes, she has some. There's no problems there. The Achilles tendon reflex, just striking the back of the calf. And of course, we're expecting to see an upwards movement at the ankle or dorsiflexion. And there is some there. Again, we'll get her to reinforce the process by pulling. And with the other leg, same thing. And she's a little bit stiff. There's a little bit of muscle resistance there, which is not unusual. The last reflex we're going to test is the Babinski reflex. And again, using the opposite end of the patellar hammer. The aim of this, and it's a fairly accurate test of motor cortex in terms of which is the controlling influence over body posture, and it's a matter of stroking the sole of the foot in an upwards direction. The normal response is for the toes to move downwards, or plantar flex. Now, in the case of Janelle, there's a slight movement upwards. Okay, we're not sure why that is. In most people, there's plantar flexion. In reality, there's not very much movement at all. And once again, because people are aware of what you're doing, and also, of course, because sometimes this does tickle, there's a slightly abnormal response. But in this case, we wouldn't expect anything abnormal because we've already noticed Janelle has no abnormal muscle tone problems or muscle strength problems. We just compare that side with the opposite side with the Babinski reflex. And in this case, once again, if anything, a slight movement of the toes in a dorsiflexion manner rather than plantar flexion. So remember, normally the response to obtain a negative Babinski, which is the normal, is that the toes should move downwards, or plantar flex. In patients that are otherwise normal, and yet you notice diminished reflexes, it's sometimes helpful to get them to focus on stretching, or at least putting tension in other body muscles. We call this a process of reinforcement, and we can either ask Angela to clench the jaw tight as she can, or we can ask her to actually put her hands together and try and pull her hands apart as tight as she possibly can. So if you can just do that for me. Hold the tension, and while she's holding the tension, then attempt to elicit the reflex. And we'll often overcome that conscious control or subduing of the reflex by getting patients to actually perform that alternate muscle activity.